Hello out there, folks. This is Peter George again with day one of the official bone marrow transplant video blog journey. Anyway, I'm sitting here at the University of Miami, Sylvester Comprehensive Cancer Center. I can never say that the right way, but anyway, it's a tongue twister for me. Um, Day one was basically getting me ready to accept the medicines that I'll be taking, the chemotherapies and the preparation medicines for the transplant. Taking out a ton of blood, probably about 10 tubes of blood. The reason they take out so much is some of it is for cultures to compare them with the blood that I may get infected. Let's say I get infected, they compare that as the control, which is when I came in and I was okay, to whatever happens when I get an infection. That way they can isolate it and quickly kill the infection or have the right drugs to take care of it, so I don't stay infected too long. The rest of it was for what they call type and screen, and that is to go ahead and have blood ready for me in case I need a transfusion because my red blood cells go way too down. Also, a lot of hydration. I'm taking saline through a drip like a waterfall, so that means I'm going to the bathroom about every 20 to 30 minutes. You have to pee in a urinal because they want to know exactly how much fluid you let out. You have to keep the water bottles that you drink to go ahead and compare that to what's going into your body and what's coming out. You have to keep the juice jars that you drink. You have to keep the sodas that you drink, the amount of ice that you drink. And that is all, again, to let them know how my body is functioning. I also got a bit of disturbing news. Apart from the, looking at the screen here to find out the thing, apart from the fludarabine chemotherapy that I'm getting, I'm also getting Rituxan, which has been an enemy of mine throughout my past 4 chemotherapies. It's a really nasty thing. It gives you like an irony, peppery taste in your mouth. Your mouth goes dry. You can get the shakes where you shake uncontrollably, like if you're shivering to death, but you're really not cold. So I got the bad news that I'm getting some of that tomorrow. So tomorrow the videotape may not be as energetic as this one is. But apart from that, I'm in great spirits. I got a great room. I got my beautiful wife with me. Where is she? There she is. That's Denise. And again, I'm sitting here. She's got a bed. She's comfortable. She gets food brought to her. She's got a menu to choose from. She is my primary caregiver, of course. Who else would there be? She could be with me throughout this entire ordeal. We just found that out, which is great news for me because I thought I'd be alone during the toughest parts. But anybody else who comes to visit me, it really all depends on how sick I am or my blood counts are. The best bet would be to keep visitors to a minimum so I don't risk a chance of infection. If I go for my walks out in the hallway, I have to wear a mask and gloves. So they've brought up the, how can I put it, the protocols. They've brought it up compared to when I was here 4 years ago. 4 years ago? 3 years ago for the stem cell transplant, where they were a little bit more lenient with patients walking around the halls. All I had to do was have a mask on. Now it's mask and gloves. Now people that come into the room to see me have to have mask and gloves. If I'm really, really bad and I need a visitor or Denise is here with me, of course she herself will have to wear, if I'm really bad, mask, gloves, and a gown. So it's very tight protocol as far as getting an infection goes, because that can throw the whole thing off. So in a nutshell, you already know what happened today. I'm on pain meds. This thing in my neck is killing me. It's sore as hell. My neuropathy in my feet is terrible. It's like jackhammering pains going through my left foot, like knives going through my right foot. Whenever I get into a hospital and this stuff begins, I don't know if it's psychosomatic, but the pain does increase. So I'm on Dilaudid by IV, which is good. I'm on oxycodone if I need it for pain, like if the Dilaudid doesn't do it. And they're also giving me a liver pill to protect my liver against this treatment. That's how strong it is. And I just started those right now. Apart from that, I'm taking all my regular meds as well. Tomorrow I will be receiving the fludarabine chemotherapy and the Rituxan chemotherapy. On the day after that, flubarotine after that, flubarotine, and then ATG1. That is, ATG is a drug. I'll tell you more about it when we get there. But I find out they call it the rabbit. And I asked them today why they call it the rabbit, and they said because it comes from a rabbit. So my wife tells me, she's got a great sense of humor. She tells me, oh, are you going to grow a little cottontail? So I thought that was cute. Made me laugh. And then on day 0, which is what they call your born on day, which will be next Thursday, that is when I get my bone marrow injected into my body. As you know, I have ice on this, but as you know, through these little tubes that you got hanging out from there, you can see it. And that's about it for today. Again, I'm going to post today on Facebook. From now on, until probably my born on day, I will no longer post on Facebook this video. It's going to go directly to YouTube. My channel in YouTube is simply my name, Peter George. You do need a YouTube account for it to count as a view. So please go to YouTube to continue watching my video blog. Comment there, all the comments that you need to do, because the more views and the more comments I get, the more people from the outside, from it without our group of friends and acquaintances, will get to see this, because it'll climb in the rankings. And hopefully, somebody out there is really going to benefit from me doing this, and help them make a decision if this is something for them to go through, or at least to give them a little hope that a guy that's going through this can still have a sense of humor and have the energy to go ahead and do this. I'm not blowing my own horn by any means, but this is a tough thing to go through, and you got to pay it forward, and that's what I'm trying to do here. So please, folks, again, my channel is Peter George. On YouTube, create your own YouTube account if you don't have one, and it'll really help if we do it that way. Okay, so it's Thursday night, day 1 of our video blog journey. It's going to have the same title going forward. It's just going to be day 2, day 3, day 4, all the way to when I'm out of here. I might even do a little snippets of walking around outside and stuff, but you're going to see this degrade. My hair degrade. You're going to see it fall out. You're going to see my face thin out. It's going to get pretty weird. But again, I'm doing it to try to help somebody. Good night, everybody. Pete signing off. Wish me luck.